Hi everyone, Cheryl here coming at you with another video in my RNY After 4 Years series. And I want to first apologize. As you can see in the background, my children are going, it's raining, it's ugly, and they cannot play. They have a big fenced yard. They can't play outside, so they're acting like lunatics in here. This is actually the fourth I've tried to record this video, and I keep stopping it, and I'm done stopping the video. Every time I fix my couch, this is what they do. You saw Dixie just scratching away. I'm done. So please ignore my background entertainment and my messy couch cover, because I don't know how many times a day I can fix this. It's just one of those days. You know how it is when your human children are rambunctious because they can't go outside and play. They get cabin fever. Well, fur children are no different, believe me. Sometimes I think they're worse. Because at least human children, you can give the video game or the iPad and tell them to go occupy themselves. These guys can't do that. So, again, please forgive my background entertainment and messy couch from the Macton Silly. Okay, with that said, let's get back onto the video. In this video, I want to talk about things that you really should do before making that initial call for any sort of weight loss surgery. And the biggest thing you want to do is research. You know, get on Google, find surgeons in your area, get on YouTube and watch other people like myself who have gone through the surgery that can offer some advice and stuff and some things that they've gone through and experiences. And always, always, always consult with your primary physician. In my case, my primary physician wanted me to get it and kept on me and on me and on me. And I was like, no. I mean, he was only trying to help me, but I was ignorant to the way things were. And, you know, Dr. Mike, he knows what he's doing. He's an amazing doctor. Love him to death. But I just didn't want to hear about weight loss surgery. I didn't understand a lot about it. My fingers are red from hair color, so you have to forgive that too. I just noticed that. I didn't want weight loss surgery to be how I got healthy and how I lost weight. I thought I had other options. And, you know, in the 2 years it took me to research, I truly believed that I could beat obesity. And I tried everything. I mean, I tried juicing. I tried, it wasn't full-blown keto. It was a version of keto. I tried Atkins, you name it. I tried it, all but taking pills. And I just, you know, at one point I lost 11 pounds and that 11 pounds came back. It's just, you know, I had to in my mind be ready for what I was about to get into. So my best advice before you do any of the other things I'm going to tell you, please do your research. Talk to your PCP. Know what you're getting into and be right with it in your mind and your heart. And at that point, when you could do that, then by all means take that next step and contact a surgical facility. So when you contact that surgical facility, what you want to ask is, you know, what kind of experience the surgeon has. How many procedures has he done? Has he had any complications? Is the facility a center of excellence? I know at one point that was a requirement for a lot of insurances. I don't know about now, but I do know it was. I'm pretty sure I had to be at a center of excellence. I'm 100% sure, actually. And my surgery was October 21st of 2014. So it could have changed since then. I honestly couldn't tell you, but I would say if it was me, I'd be looking for a surgeon that is affiliated or part of a center of excellence. I'm going to go through my notes again because I have a lot of things written down, and this might be a two-part video again because I have a lot of things written down. So, okay, now you contact your surgeon and or the surgical facility and you ask questions. That does not mean that you have to just contact that surgical facility. I would contact 2, 3, maybe 4. I would get on, is it Yelp? I'm not sure. And I would look up reviews on these surgeons, I would get on that computer and I'd be researching my heart out, which again I did for 2 years. I really didn't research my surgeon simply because I went where my PCP said. So I didn't research that. But what I did research are the procedures, the complications, how your life's going to change, what you have to do pre-op, post-op, things like that. And YouTube was my best friend. I still follow a lot that I went to get questions answered. And that doesn't mean I comment it. I really didn't. I just had my questions in my mind or written down, and I went and I researched YouTube and I found answers I needed and I wrote them in my notebook. Somewhere in my sewing room, in a file box thing, along with my post-op diet plan, I have a notebook packed with questions I asked, questions that were answered, pre-op, with my surgeon, with the nutritionist and all that stuff. And I also have questions that I researched on Google, I researched on YouTube. I mean, it's not something to take lightheartedly. Okay, so now you picked out your surgeon, okay, and you're ready for the process. Now what you do is you sit down. I didn't see my surgeon until the second to the last appointment pre-surgery. So, who did I meet with? It was she was the PA, I guess. She was the PA. She wasn't a surgeon. She surgically assisted, she did that. But, in fact, she assisted with my initial surgery. But, I saw her, I saw the dietitian, and at those sessions, I asked a boatload of questions. And there were times, even after I got out of my appointment with them, I would stand there and talk to the receptionist, the office manager and stuff. I still had questions. You should have a ton of questions, and I mean a ton, that you're still asking the day of surgery if you want to know the truth, and seeking after surgery for quite a long time regarding this surgery. If you don't, I really question why. Why don't you have a bazillion questions, really? So, okay, you get into that appointment and you want to know a lot of things. One of the biggest things there, once you're in the door, is what are my pre-op requirements? Okay, do I have to do a pre-surgery diet? Do I have to lose weight? I hear a lot of people have to do 2 weeks liquid before, some are 4, before they even go in for surgery to shrink your liver. Do I have to quit smoking? Do I have to, okay, in my case, let me put it this way. I was on naproxen for my back. I had to be off naproxen, I'm pretty sure, 2 months before I could even think about scheduling surgery. That had to be out of my system because it's a blood thinner. So I had to be off naproxen, and it's also an NSAID, I'm pretty sure. So I can't take naproxen for the rest of my life. I have been off and have not returned naproxen. I was on tramadol. Tramadol was another one I'm not allowed to take and wasn't allowed to take pre-surgery. What medications? An extended relief medication you can't take anymore because of malabsorption. You can't, you won't get the effects of an extended relief medicine. There's just so many things that go into this, and there's so many things that you're going to need to ask, and so many questions that won't be asked, because it's actually overwhelming the amount of questions that there really are going into all of this. So, okay, you want to know what is offered pre-op and post-op. Like, after post-op, how many surgeon visits will you have? How many times will they do blood work? I know, if I remember correctly, it was 1 week post-op, 2 week post-op, then a month, then, actually, let me phrase that right. 1 week post-op, 2nd week post-op, and then the 4th week post-op, which put me at my first month, okay? Then I'm pretty sure it was 1 month, once a month till my 6th month. Then at my 6th month, I didn't go back till my year. I'm pretty sure. But that's something you're going to need to know. And if you're, you know, do you have to pay for those follow-up visits? Are they part of your surgical package? Does insurance cover it? If it's not part of your package, let's see. What vitamins? Every surgeon, it seems, recommends different vitamins. A lot of them are the same, and I'm not going to rattle them off simply because, excuse me, this rainy weather does this to me. Simply because every surgeon and every surgery, what you take is different. So for me to sit here and say, you're definitely going to need iron, you're definitely going to need calcium, I don't know that answer. That's a question only your surgeon can answer. And then post-operative, based upon your blood work results, that's, again, something only your body at that point and the surgeon can answer. So you want to ask him what vitamins initially he's going to want you on after your chosen surgery. What surgeries does he offer? When I went, lap band was a choice, but it wasn't because my surgeon said right out, we don't even perform it anymore. It's kind of like a pointless effort. So my choices were the bypass and the sleeve. I never heard of the duodenal or duodenal or however you say it switch. I never heard of distal bypass. I didn't know any such thing. But now I know people are getting the duodenal switch thing, and there's also the distal bypass, and there's revision from revision surgery is a completely different animal. That's post-op and beyond. So we're not even going to talk about that. But you want to know what surgeries they offer, how many of them they've done, what success rate have their patients had, and what do they recommend for you, and of course, why. You know, if they say, well, hands down, I want you to get the sleeve. Okay, why out of all the surgeries, out of these surgeries offered, do you feel I'm the candidate for the sleeve? Ask. In my case, they wanted me to have the sleeve, and I refused because my research led me to understand that with the sleeve comes acid reflux, which I already had so bad. 2 Prilosec a day and chug a Miralax at night was not helping me. I was a mess with acid reflux. The last thing I wanted was a procedure that entices acid reflux. There was just no way I was even going to put myself in that position. So they were sleeve, and I was like, absolutely not. Bypass or nothing. I'm not even going through that. I'm doing this to get better, to get healthy, to help my quality of life. And as bad as I have acid reflux now, I'm not even going to go that route. So there's another instance where having your research done and knowing before you walk through that door things that you should know, because then you could sit there with an educated mind and a comprehension and have an educated talk with your surgeon or your PA or your nutritionist or whatever. You want to be prepared walking into that room. Okay, for right now, I'm going to pause this video and I'm going to do a part 2 because I'm already sitting at 13 minutes. And I know I'm going to probably be at least another 13, 14, 15 minutes. So hang tight and I'll be right back with a part 2 that you can click on after this video. Thanks for being here with my video number 6, RNY after 4 years, what you should do and find out pre-surgery. All right, be right back. Thanks so much.